My name's James and I'm a recruiter on the mental health and psychiatry team.
My name's Adam Spenceley. I am the Director of Mental Health and cover all grades and specialities within psychiatry and therapies.
My name's Elliot Moore. I head up our psychological therapies team, which covers everything from psychological wellbeing practitioners, CBT therapists, and clinical and counselling psychologists. It's something that personally interests me. Mental health is so prevalent throughout society, and over my time in the industry, I've seen the awareness of it raised so much, so it's nice to be part of something that's making a difference and is so important.
There's many aspects I enjoy. I think I get quite a high sense of achievement out of knowing that we've placed, candidates into their perfect jobs, and the knock-on effect that then has into the patients that are receiving care, and knowing that we are actually making a difference to people that really need the help at the end of the line, really.
Leading the team, I'm quite privileged because of the people, colleagues and friends I work with. But I think just going on the back of that we're contributing towards finding staff for specific areas that are under a lot of strain, mental health. I feel like we're doing a really good job of what we do. So I think there used to be quite a taboo about not really talking about how you generally feel, especially within especially men, boys, wherever it was. But having gone through a few things in my life personally, I never really spoke about stuff. Later on in reflection, it is best to talk to someone. It doesn't matter if it doesn't have to be a professional, it doesn't have to be a family member. Just speak to someone. And also it's key for other people as well to recognise the signs, if possible, in other people. There's nothing wrong with asking someone if they're all right or if they're having a good or bad day. I think it's something that needs to be pushed in society more. So, yeah.
I think it's just important that the awareness is raised, that the message keeps on getting out there to people, to check in on friends, to check in on colleagues, friends, etc. And as long as that message is being portrayed, and people will feel that there's less of a stigma around reaching out for help if they're going through a bit of a tough time, or even if they start to recognise the signs that they might be headed into a bit of a downward spiral, to sort of know that actually we can try and prevent this from blossoming into something more serious. That's also something that the Mental Health Awareness Week will help raise the awareness for.